Hello everyone, myself Priyal Jaiswal. Today we'll see the questions of differential diagnosis of lower quadrants of the abdomen. First, we'll see the preliminary data. Patient details: name, age, sex, status, married or single, address, educated up to occupation. From this, we can get the area they are living, like in rural or a urban area. We can also get to know about their socio-economic status. What are the lower three quadrants of the abdomen? Right iliac fossa, hypogastrium, and left iliac fossa. Differential diagnosis which cause the lower abdominal pain. IBD, malabsorption syndrome, CA cecum, CA colon, intersusception, volvulus, intestinal TB, diverticular diseases, UTI, appendicitis, ectopic pregnancy, endometriosis, cystitis, salpingitis, tubo-ovarian mass, ureteric colic, acute constipation, prostatitis, BP, intestinal obstruction. First, we'll see the disease appendicitis, which is very common disease. Age. So what is the importance of age? Common in children and in 20 to 30 years of age. Sex, more common in males than in females. Diet. Ask about their likes and craving. If they are veg or a non-vegetarian, from this we will get what kind of food they eat. High protein and less cellulose in diet lead to appendicitis. Any non-veg food which precipitates your pain, we'll ask the patient. Patient will say, yes, I have observed that after eating meat, I usually get the attack of pain. Family history of mother, father, sibling, maternal, paternal, grandparents, paternal, aunt, uncle, etc. who have the same complaint. About pain. What is the location of pain? Where is the pain? If he can point out the area of pain. Answer. Patient will tell us that first the pain is felt in umbilical region, then after few hours it get localized in right iliac fossa. Is the pain migratory or shifting? It is shifting. Sensation, what kind of pain does you feel? If patient say that he feels dull aching pain, we can think of obstructive appendicitis. If patient says that he feels colicky pain, which is intermittent, we can think of non-obstructive appendicitis. Modality. Any particular time you have noticed when the pain increases, patient will say that it aggravates in morning. Any position, motion which increases the pain, it aggravates walking and jolting. How long is the history of present complaint of pain? Pain of varying intensity appearing on and off for last few years. What happened before, during, or after pain? First there will be pain, then vomiting, and then fever would come. Is fever very high? No, it is usually of the low grade. In past, did you have any problems of constipation? Yes. In children, they usually complain of diarrhea. In past, do you have any previous attack of such pain? Patient will say yes. How is your appetite? Patient will say it is reduced. When we palpate, there will be rebound tenderness of right iliac fossa and tenderness at McBurney's point. Roving sign will be positive. Sluggish peritoneal sound will be felt on auscultation. Pulse rate is usually elevated. Now we'll see the Crohn's disease. Family history. Anyone in family has the same illness? Habits. Does he or she smoke? If yes, since when? Smoking increases the risk of Crohn's disease threefold. Any psychological stress, any kind of emotional stress, occupation, tension, any incidents that has happened in his or her life that has left the deep impact in them, and how many years back the thing happened, and then correlate the years since when the complaint has started, if it would be due to the stress or incidents. Have you been on any strong allopathic medications for any diseases? If yes, for which disease? Because long-term use of NSAIDs can lead to IBD. Pain, how is the onset of pain? Is it sudden or insidious? Patient will say insidious onset. Location, where do you feel the pain? In right iliac fossa and in the hypogastrium. Sensation, which kind of pain you feel? Colicky pain, which is intermittent. Is there any nausea, vomiting present? Yes. Is there any kind of flatulence which causes you discomfort? Yes. Where does you feel flatulent? In lower part of the abdomen. Stool, a patient will complain about diarrhea in the initial stages. Is there any blood, mucus, or pus in stool? Yes, there is mucus in blood, or yes, there is blood in the stool. If they say blood in the stool, we need to understand that now the colon has also involved. Has your weight decreased since you have got this complaint? Yes. Is there any fissure, fistula, or any outgrowth in the anal region? It is the yes, it is pain. If it is present, is it painful or painless? It if it is bleeding or non-bleeding. Signs and symptoms of anemia will be seen in a patient. Ulcerative colitis. Age, common in third decade followed by fourth and second decade. Sex, female is to male ratio is 2 is to 1. Psychosomatic cause. During mental, ask if there is any kind of stress, emotional tension and correlate it with happening of the disease. Any food allergy, milk or milk products? Answer is yes. Any kind of pain? Is the onset sudden or gradual? Answer will be the gradual onset. Location of pain, patient will say that in left iliac and hypogastric region. Ask about the stools. Consistency of stool, watery stool. Frequency of stool, 15 to 20 stools per day. Or if 30 to 40 stools per day, then think of the acute fulminant ulcerative colitis. Any blood or mucus in stool? Yes. If more blood, we can think of chronic relapsing type. Can you control the stools? No. Urgency and tenesmus is well marked in acute fulminant. Is there any pain while passing stool? Yes. Is there cramping felt in lower abdomen? Yes, usually in chronic and continuous type. If cramping is not marked, we can think of acute fulminating type. Is there any fever during the attack? Yes, usually 39 to 40 degrees Celsius. Have you observed that after any stress or any emotional tension, you get frequent relapse of pain and diarrhea? Yes. We can think of chronic relapsing type of ulcerative colitis. Is there any mucus coming out of rectum? Yes. Anorexia, weight loss, features of anemia, severe dehydration is seen. On examination, tenderness in left iliac and hypogastric region is felt. Now we'll see intestinal TB. History of pulmonary TB. Do you have got TB earlier in your life? Answer will be yes. How many years ago? Pain. How is the pain? Dull, vague, and sometimes colicky pain will be felt in the abdomen. Location of the pain in right iliac fossa. Modality, how does it increases or decreases by something? Yes, it increases after taking food. Is it relieved by something? Patient will say yes, it is relieved by vomiting. Ask about the stool. What is the quantity of the stool? And patient will say scanty stools. What is the consistency of stool? What are the stools? Odor, foul odor of the stool will be present. Is there any blood in stool? Yes. We can think of intestinal TB, which is of the ulcerative variety if there is blood in stool. Is there fever when this attack comes? Yes, we can think of hyperplastic variety of intestinal TB. Is this kind of stool present every day since you got the complaint? No, alternate day there is hard stool and watery stools. Is there any flatulence present? Yes. Have you experienced fullness of abdomen? Yes, sometimes it's there. How is your appetite? It is reduced since I got the complaint. Have you lost your weight since you got the complaint? Yes. Patient is pale and malnourished. Visible intestinal paralysis may be seen. Distended bowel lumps can be palpated. Mass felt in right iliac fossa. Now we'll see sigmoid volvulus. Age, common in middle age and elderly greater than 60 years. Mainly occur in people of severe psychiatric and neurological diseases. Sex, common in male. Do you have any history of CVS or any pulmonary diseases? It is most common in people having CVS because it is most common in the people having CVS or pulmonary diseases. Occupation and the area of living. It usually occurs in people living in the rural areas. If she's female, ask that if she's pregnant. If she says no, because it is uncommon in pregnancy. Pain, the onset of the pain. Patient will say there will be sudden onset. Sensation of pain, cramping pain in abdomen. Modality, what relieves the pain? Passing of large flatus and stool relieves the pain. Is there any similar kind of pain in the past? Yes, sometimes in left iliac fossa region. What happens after the passage of stool? Distension of abdomen is felt. Where do you feel the distension? First, it is felt in left iliac fossa, then involves whole abdomen. Is there any nausea and vomiting? Yes. What happens before nausea? There are a lot of hiccups and retching, which then follows nausea and vomiting after few hours, the patient will say. On auscultation, tympanic nodes will be felt all over abdomen and dilated loops can be seen and felt. Now we'll see diverticulosis. We first ask the age of the patient. Usually it occurs in the old individuals. History of any cardiovascular disease or atherosclerosis or hypertension. Do you have any bleeding coming from rectum? Patient will say yes, there will be profuse bleeding. How is onset of bleeding? Sudden onset and unexpected. How is the pain? Location of pain in left iliac fossa. Sensation vague abdominal pain. Do you feel any distension of abdomen and where? Yes, in the lower part of the abdomen. Is there flatulence? Answer will be yes. Now we'll see diverticulitis. Ask about the pain. Location will be deep in the left iliac fossa and suprapubic region. Sensation dull, continuous, and aching sometimes. It may is intermittent and cramping. Modality, how the pain decreases by passing flatus. Is there nausea and vomiting felt? Yes, there is nausea but no vomiting. How is your appetite? We'll ask the patient. Patient will say it is decreased. Stool, how is your stool habits? Is it normal? Patient will say no. Sometimes there is constipation and sometimes diarrhea. Is there any fever? Yes, low grade fever is usually present. Is there any bleeding from rectum and of which color the blood is there? Yes, the blood is of dark red color. Now we'll see salpingitis. How is the pain? When does the pain start? At the time of menstruation. Location, whole lower abdomen, that is whole two iliac fossa and hypogastrium. Is it radiating or static? The pain is static. Is there any fever? Yes, usually 102 degree Fahrenheit. Is there any difficulty in urination? Yes, there is pain during urination. Sensation of pain, scalding pain during urination. Is there any vaginal discharge? Yes. Is it offensive? Answer will be yes. Is there any pain during menses? Yes, there is severe pain during menses. Now we'll see cystitis. A sex common in women. How many times a day you have to go for urination? Patient will say both day and night there is increased frequency of urination. Desire is felt every 1 hour to 15 minutes. Can you control urine? No, I can't control. There is urination on laughing and even on coughing. Then sneezing. How is the pain? Location is suprapubic region and tip of penis in male and labia majora in females. Sensation mild agonizing to severe pain. Is there any blood in urine? Blood comes at the end of the micturition. Is your urine hazy or cloudy? Yes. It is called as pyuria, which is the presence of WBCs, pus cells in urine, but it occurs in the later stages. On examination, tenderness is felt at suprapubic region and hypogastric region. Tenderness is felt at urinary bladder. On rectal examination, there will be tender prostate in male. Now we'll see benign prostatic enlargement in males. Age usually in elderly people. We'll ask that if their frequency of urine is increased, they'll say yes. When it is more during day or night, they'll say in starting it was only in the night, but now it is more in on both day and night. Is there any urgency to pass urine? Yes, I was. Yeah, they say yes. They feel that urine is tickling in urethra, and there is intense desire to urinate. Did you have to wait for long time to pass urine? Yes, that's why I am hesitate to pass in front of others. Is there any blood in urine? Answer will be yes. Now we'll see prostatitis. Age usually in elderly. Urine, is there pain during micturition? Answer will be yes. Sensation of pain, burning sensation is felt. Is there frequency of urine increase? Answer is yes. Is there any thread-like white discharge in urine seen? They'll say yes. Is there any fever with chills? Yes. Temperature is usually high. How do you feel backache? Yes. Is there any pain in rectum while passing stools? Yes. We'll see pelvic inflammatory disease. How is the pain? Location in hypogastrium. Is there any backache? Yes, backache is usually very marked in PIDs. Is there pain during sexual intercourse? Yes. Is there any white discharge? Yes. Is the white discharge odor or odorless? It has foul odor. Is there any spotting or bleeding in between the cycles? They'll say yes. Now we'll see the endometriosis. Age usually in age 30 to 45 years. Parity usually common in multiparous. Family history is often seen. Do you have any severe pain during menses? We'll ask the patient. She'll say yes. Is there any blood in urine? Yes. Is there any pain during urination? Yes. Is there any pain during stools? They'll say yes. Is there any bleeding from rectum? Usually bleeding will also be present. Any medication have you taken for your pain? Yes, she'll say that yes, since 5 months, but the pain has not relieved. Do you feel backache during pain? Yes. Do you feel the pain during sexual intercourse? Yes. How much is the menstrual flow? Like how many pads do you use in a day? Yes, there is profuse bleeding. Is there any spotting before menses? Yes, sometimes there is spotting. Is there pain still after the menses or they disappear? Yes, but it takes long time to go after the menses. Thank you.